Mental Health Innovations is a charity which uses digital innovation, data, insights, and clinical expertise to improve the mental health of the UK. At Mental Health Innovations, we offer a range of services which include workplace training, digital resources, and our 24/7 crisis tech support service, Shout. So Shout's our first product at Mental Health Innovations, and it's the UK's only free, confidential text messaging support service. It's there for absolutely anyone to text the word shout to 85258 and they'll receive anonymous mental health support at any time of the day or night. The shout really resonates with children and young adults. In fact, 60% of all of our users are under the age of 28. I think in today's age, it's incredibly important for people to have lots of different means to communicate and access support for their mental health. So we work in partnership with a range of organisations through our keyword service. Now this allows organisations to create a bespoke word that replaces shout when texting our service for support. Now this unique keyword is there for organisations to share with their service users, their staff, or their customers when they need help and support with their mental health.
We've got this increasing problem with young males and females who are presenting on the network who are in distress or in crisis, and we need to respond to that. The keyword is journey on and around the rail infrastructure. So there will be signage particularly in the stations where we consider the risks to be the highest. So whether it's somebody coming through our stations or whether they happen to be on their phones in and around stations, hopefully they will have access to that messaging and that keyword. We chose Shout because this young demographic, and we want to reach them. They're a text service and that's going to appeal to young people. It's also discreet as well. So if you are in and around our infrastructure and you want to reach out for help, then a mobile is a very discreet way of doing that. It needs to be a national service because we're Network Rail and we cover England, Wales and Scotland. So we need to be able to cover all of those areas. We're also reassured by the fact that their volunteers are supported by clinicians. The relationship with Shout itself has been really successful. So it started out as a small trial, which we've rolled out to the wider industry as a whole. It's now national. And in that time, it's taken over 5,000 conversations with people who mention railway or track. 85% of those people have mentioned suicide as an issue. And in the first 5 months of our partnership, they've taken over 100 conversations with people who are in crisis.
We know that people don't just need mental health support between the hours of 9 to 5. So we're able to give people the Shout details so they can access mental health support, advice and guidance 24 hours a day.
Working with organisations like Kaleidoscope enables Shout to work in partnership with charities who are having a direct influence on certain vulnerable groups and communities who may be at risk of suicide.
People haven't always been aware of what the service is, so when they have text the service, they've been blown away by the support that's been offered.
So with our keyword service, we aggregate and analyse keyword usage to generate anonymous insights into the mental health trends affecting the organisation's texters. And we report this back to partners, which helps them understand who's reaching out for support, when, and what issues they could be facing.
This then helps us to evidence the need of mental health services, which then allows us to get further funding and work with our commissioners to show the need for 24-hour mental health services.
It helps us take a more strategic approach in the future to how we sort of respond to the challenge of suicide and vulnerable presentations. Found them to be fast, we found them to be efficient, really easy to work with, friendly, and also really clear about what can and can't be achieved. We each come with our sort of boundaries, concerns, and and that was all established right at the beginning of the process, and that's just led to an easy working relationship, which we're very grateful for. For us, it's trying something new. Our experience has been really positive. So yeah, absolutely reach out. I would definitely recommend them.
Our vision at Mental Health Innovations is that everyone in the UK has access to the digital mental health services they need and can access appropriate, high quality support quickly and efficiently through the power of technology. And our keyword service enables mental health innovations to do exactly that.